I just wanted to welcome everybody to the webinar on social protection policy and practice in Somalia. So the background to the event is this increasing awareness of the need to complement short-term support like cash transfers with longer run development-focused interventions. And today we're going to look at this question for Somalia specifically, where the context is very particular because of a number of factors, but maybe importantly, large internally displaced population and compounded by very serious weather-related shocks. So a critical question is how, both amongst the displaced and the non-displaced population, we can move from humanitarian support to longer-term development goals. And this webinar aims to be on the interface between policy, practice, and research, and we want to encourage that three-way conversation. So we'll have research presentations, one on work related to the national level social protection program, BACNANO, and another one evaluating the impact of an ultra-poor graduation program in Baidoa. And after those research presentations, we'll have reflections from a number of stakeholders, starting with a representative of the Ministry of Labor and Social Affairs, the lady you see on the screen here, Fardosa. She manages the National Safety Net. And then we'll also from World Vision, who implemented the Baidoa intervention. And we'll also hear reflections from other key stakeholders in the space, representatives from FAO, the Somali Cash Consortium, WFP, and World Bank. So in terms of housekeeping, we've got 1.5 hours set aside. If all speakers stick to their allotted time, we should have about 20 minutes for Q&A at the end. So participants, you can ask questions in the chat, and I can post them. If you do, please state your name, and maybe if you've got a particular person you want that question to be addressed to, let me know. There should also be the option of people switching on their microphones and videos and asking a question or making a comment. So we'll start with two speakers, and they are going to set the stage for the webinar. The first one is Kate Ambler. She's a senior research fellow at IFPRI. And Kate is an applied microeconomist with a portfolio of impact evaluations in fragile settings. And she also coordinates a component of a CGIAR-wide science program, which is called Food Frontiers and Security, under which a lot of the research on food systems in fragile settings done within the CGIAR falls. And Kate, I'll ask you to hand over to Karishma. And I'll introduce Karishma already. Karishma Silva is an economist at the Fragility, Conflict and Violence Group of the World Bank. And she has led the measuring impact work to estimate the global cost of providing refugee education through national systems, which informed the 2023 Global Refugee Forum multi-stakeholder pledge on education. And importantly, she's the co-author on the recently published book, Making Refugee Self-Reliance Work from Aid to Employment in Sub-Saharan Africa. And her talk today will largely draw from work on that book. And I understand from her and her co-authors that we're getting a bit of an exclusive, because this is actually the first time this work will be presented. So we're very excited about that. So Kate, I'll hand over to you. You've got 5 minutes for your opening remarks, and then you can hand over directly to Karishma, who has 10 minutes, and then it'll come back to me.
Great. Thank you so much. Thank you so much for having me here at this event examining how we can harness research to inform social protection policy in Somalia. The research that is to be presented here today is part of IFPRI's larger research portfolio focusing on fragile and conflict-affected settings. While IFPRI has been doing research in these settings for many, many years, it has been growing as a priority in the past couple of decades due to the acknowledgement that our vision of a world free of hunger and malnutrition cannot be achieved without addressing the growing concentration of poverty and hunger in fragile settings. Our past and current work in these settings was in fact recently summarized in a chapter of the new IFPRI Global Food Policy Report. Some of these projects include evaluations of trainings for improved agricultural inputs, trainings to increase women's voice in conflict-affected areas of Nigeria, subsidies for improved agricultural inputs in communities with IDPs in Nigeria, evaluations of cash transfer programs combined with mental health services in conflict-affected areas of Ethiopia, the impact of digital cash transfers in Sudan, evaluations of cash for work programs in Yemen, and many, many others. Just a few examples of some of IFPRI's recent work focused on recovery in fragile settings. IFPRI's work in these areas is made more impactful as well by the local presence and dedicated programming that we have in many circumstances. This includes offices or country programs that are dedicated to working with policymakers and governments in places like Nigeria, Ethiopia, Sudan, Myanmar, and others. Today, I'm also representing the new CG Science program on food frontiers and security, which supports policy research in frontier food systems, including a very large body of work on fragile and conflict-affected food systems. Our research in this program is centered around 3 phases of conflict. First, there's an area of work that's studying prevention with a large focus on disaster risk reduction strategies, anticipatory action programs, and other approaches that can prevent conflict or shocks or mitigate their impacts. We also study recovery efforts, seeking to understand how programming can be best designed to provide relief in food systems in crisis and build a bridge to recovery, including analyses of where vulnerabilities are greatest, causal impact evaluations of programming, and applications of a humanitarian development peace nexus approach to promoting peace, long-term development, and sustainability. Finally, we focus on recovery efforts, understanding how policies and programming can best be designed to build resilient food systems. This involves demand-driven, rigorous causal impact evaluations of approaches to stabilizing livelihoods and promoting resilience during recovery from conflict. Our work spans a large number of fragile and conflict-affected settings and is driven by our strong partnerships with organizations that do the work of implementation. These partnerships drive the research questions we ask, inform the design of our studies, and our results are meant to directly influence their operations. Somalia, the focus of this webinar, is an important country in our research portfolio, and we've had the privilege of supporting some of the excellent work that will be presented shortly. Moreover, the speakers assembled here today are a great example of the work that we strive to do in the Food Frontiers and Security Program, conduct and produce demand-driven and policy-relevant research that is meant to spark a meaningful conversation with experts in the policy community from government, local, and international NGOs, the private sector, and more. The topic is also at the core of the work we want to do. How can programming, in this case, social protection, be best designed to serve the purposes of building resilient food systems? I am delighted to see the gathering of experts at this event today from such a wide range of institutions, and I'm glad for the opportunity to focus on the context of Somalia to advance a conversation about tailored programming for this particular setting. I am sure we will leave this event with new ideas and directions for the growing research program here. Thanks again for having me, and I look forward to the presentations. And I will hand off to Karishma. Thank you.
Thank you, Kate. I'm just going to ask Jessica if you could please share the slides.
Okay, now?
Great, thank you.
Perfect.
Perfect. Thank you. So good morning, everyone, and thank you for this opportunity to present our work, as Joachim said, on making refugee self-reliance work. I'll be doing a bit of context setting on why we need this shift from short-term humanitarian aid to more longer-term development approaches to forced displacement situations. And a lot of the analysis that will be presented in this session today focuses on refugees, but is equally applicable to IDPs because they share similar characteristics in that they have lower levels of self-reliance and higher levels of poverty than their hosts, and that they largely live in encamped settings. Next slide, please. So we're operating in an environment of declining humanitarian aid. And even before the funding cuts announced in 2025, humanitarian aid had fallen by 11%. And we expect this to fall by as much as 45% in 2025. Next slide, please. And this has implications for the amount of aid available per forcibly displaced person. We see the trends on the left side of IDP populations increasing by nearly threefold in the last decade. And what that means is that if the IDP population remains stagnant and doesn't change next year, we expect a 60% reduction in the amount of aid per FDP from 2011. Next slide, please. And so, like Joachim said, here we have the links to two important works. On the first on making refugees self-reliant, that argues the case for jobs as a durable pathway to refugee self-reliance and using economic inclusion as a way of shrinking the financial burden of hosting. And in the second work, which we won't talk about today, but is available for you to look at, we present a methodology to estimate the cost of subsistence needs assistance for refugees, and we show how greater economic inclusion reduces those costs. Next slide, please. And so for the next couple of slides, I'm going to talk about the key messages from the Making Self-Reliance work piece. So one of the novel features of this work is a new simple definition of a simple way to measure self-reliance. We define self-reliance as having an income or consumption that's above the poverty line when we exclude humanitarian aid. What this does is that it anchors self-reliance to poverty measurement, which is a well-established field. And it also suggests that refugees or forcibly displaced people cannot be self-reliant if they rely on humanitarian assistance to meet their consumption needs. It also implicitly means that in a protracted situation where hosts can be extremely poor as well, that we use the same standards to measure welfare outcomes for forcibly displaced people as we would for nationals. Next slide. Right, so across sub-Saharan Africa, very few refugees are self-reliant. Refugees are less self-reliant than hosts in all countries shown on the right. And while not presented here, IDPs in Niger are equally self-reliant as refugees and therefore a lot less self-reliant than hosts. We also see in low-income countries that refugees are more likely to be self-reliant if the country has more progressive economic inclusion policies, like in Niger versus Ethiopia, for instance. Next slide. Right, so across sub-Saharan Africa, refugees in camps have very low levels of self-reliance. And you can see this across the 4 countries represented here. But I want to focus on 4 key messages from this. First, it matters where the camp is located. So if you look at the data for Kenya, refugees in Kakuma and Kalobei, which are the more remote camps, have far lower levels of self-reliance than refugees in Dadaab camp, which is closer to a city center. The second point is that some countries are pursuing area-based development, like we saw in Kalobei, as well as what is being promoted in the Shirika plan. And the data indicates that this is less likely to be effective in promoting refugee self-reliance, just because these areas can be so remote and economic opportunities in these areas are limited, not only for forcibly displaced people, but also for their hosts. Thirdly, even in countries that promote or have policies that allow for freedom of movement, for instance, in camps, for instance, in Chad, refugees still tend to cluster around camps, largely where assistance is provided in kind, for instance, like in the form of shelters or schools and hospitals. Refugees will still cluster in camps where economic opportunities are limited. And that provides a justification for shifting away from place-based, in-kind assistance towards portable cash-based assistance. And lastly, we see even with the most progressive refugee hosting regimes, for instance, in Uganda, refugees in settlements, only around 9% of refugees in settlements are self-reliant compared to 91% of them in Kampala. And this might be a bit of self-selection for the refugees that move to Kampala, but also because while a land-based strategy can be effective in promoting self-reliance, the size of these settlements are so large that there's inadequate land to distribute amongst the refugees. Next slide. Yet, even though we see all of these challenges in how encampment can limit self-reliance, we see that in Africa, nearly 74% of refugees live in camps or camp-like situations, and this is far higher than in any other region observed in the world. Also, almost all in-camp refugees, 99.8%, live in either or either blend countries. And what this means is that there's some potential to leverage developmental financing to promote disencampment and dispersion of refugees. Next slide. There's large variation in the amount of aid that poor refugees receive across countries, and this can't really be explained by the number of refugees that a country hosts, nor by their hosting policies. Further, there's a large gap, there's a lot of variation even within countries, in that refugees that live in camps receive far more aid than those living outside of camps. And from a humanitarian perspective, this makes sense. Aid is directed where refugee needs are the highest. But from a development perspective, it suggests a perverse correlation in that aid is directed where self-reliance is hindered the most. Next slide, please. Here we show the sources of consumption financing relative to the poverty line, and we see that refugee income, self-earned income, contributes far more to consumption than aid does. What it also means is that for the shortfall to be filled by aid would have to increase by 100 to 250%, which is simply not feasible in the current financing environment. Whereas if the shortfall were to be made up by strengthening refugees' economic earning opportunities, then income would have to increase by 35 to 95%. And now that's also ambitious, but far more feasible when we look at the income gaps between refugees and the hosts surrounding where they live. Next slide. So the cost of hosting is a function of host countries' policies. First, when refugees' earning opportunities are restricted, there's greater need for assistance and vice versa. And greater dispersion rather than clustering in a camp reduces the cost of hosting because there's less congestion on public services, and also because the spillover costs in terms of impacts on labor markets, demand for housing, markets essentially that are inflexible or take time to adjust. The spillover costs there, the spillover impacts are lower if refugees are dispersed. Next slide. Okay, last slide. So in conclusion, to shift from a humanitarian approach, which is largely what is used now, towards a more development approach, what we need is a new funding model that aligns financing not just with the needs as we see today, but also with the hosting policies of the country that host refugees or FTPs. This also means that governments have to take charge of the FTP response and the development sector could support that by directing financing through governments and strengthening their capacity to support inclusive policies and avoid parallel systems. And in this presentation, we've seen that self-reliance can be hindered or can be strengthened with increased economic opportunities for refugees and supporting their or even forcibly displaced people and supporting their income earning opportunities through greater disencampment and dispersion and through portable assistance. And some of the impact evaluations we're going to look at now are critical in providing insights into these questions. Thank you.
Thanks so much, Karishma. That's very insightful and really shows the the imperative and the urgency of making the move from short-term humanitarian assistance to longer-term development and job-focused interventions. Let's zoom in on some of the research that's been done on Somalia by IFPRI researchers, and in particular, Aulo Jelly and Jessica Leet. Both of them are senior research fellows, and amongst some of our finest researchers at IFPRI, I should say, and they'll be presenting two distinct pieces of work, one on the national level social protection program in Somalia, which Aulo will do. Aulo, you've got about 10 minutes to do that in, and then Jessica will be presenting an evaluation of the impact of an ultra-poor graduation program in Baidoa. And Aulo, you can just hand over to Jessica immediately.
Wonderful. Thank you so much, Joachim. Thanks for the very kind introduction, and good morning, good afternoon, everyone. I'm really delighted to be here with you to present a very quick summary of a very rich study. Can you hear me okay? I'll keep going. A mixed method review and feasibility study of the Bahnano government-led national safety net program. And I'll be presenting on behalf. Oh, hello, everybody. Sorry, can you hear me? I hope you can hear me
We
now.
lost you for a moment, but now we can hear you.
We lost you for like 15 seconds.
What was the last thing you heard?
I'm not.
I'll be
I'm-
presenting on.
Okay, cool. I'll just be presenting on behalf of a fairly large research team, including Lilia Bliznashka, Odichin Mabuiko, Ampadiata, Sumejit Rai, Elise Ruhirie, and myself. Next slide, please, Jessica. So in terms of setting the scene, jumping straight into Somalia. Somalia is a country of 17 million people who has been facing recurrent climate shocks and over 2 decades of protracted conflict, resulting in over 4 million people that are estimated to be living in crisis or emergencies, IPC phases 3 or worse, and leading to approximately 1.7 million children estimated to be acutely malnourished. In parallel, approximately half of the Somali population live below the poverty line, with important heterogeneities, including larger shares in nomadic populations, followed by rural, and the smallest shares of poverty in urban populations. Next slide. Somalia is also the largest coastline in the African continent. It was a finding that I was surprised to learn, having just started to work in Somalia, but just shows a whole range of heterogeneities, not just temporal, but spatial, in terms of livelihoods and different types of vulnerabilities. To address these constraints, the government of Somalia established its first national safety net program, the Bahnano, to deliver a safety net to the poorest of its citizens. Bahnano is a complex safety net, including 4 components: cash transfers, nutrition linked, and we'll spend a little bit of time to unpack what this nutrition link means, which is the core of the work that we've been doing at IFPRI. A second component includes integration with and strengthening of delivery of national systems, including capacity strengthening for the delivery of quality services. The third component involved project management, monitoring, evaluation, and knowledge management support. And last but not least, the fourth component included the development of a household registration as part of the Unified Social Registry development. The program was administered by the Ministry of Labour and Social Affairs, MOSA, with support from WFP, UNICEF, and partners. Next slide. This study was designed to provide evidence on the quality and fidelity of the Bahnano program implementation, and also get a handle on the perceived program benefits from beneficiaries, but also get a better understanding of the challenges and trade-offs in terms of implementation and scale. We were kind of hindered by the lack of a baseline study to be able to give us the opportunity to design a rigorous impact evaluation. So the focus of this mixed method study is really around how the program was designed. Was it designed to meet its its objectives and how its implementation was aligned to its original design. The specific objective included a particular focus on the fidelity of the program implementation, including challenges and facilitators of implementation. We spent some time to examine the benefits, the potential benefits as perceived by beneficiaries of the program. But we spent quite a bit of time to see how could the program be improved in terms of the next phase of programming, including specific design features that could align program design to its ambitious objectives. And the idea was to provide inputs into the next phase of programming, including the shock responsive safety net components, the complementary activities, but also the impact evaluations that are needed to help guide evidence-based decisions. The whole idea really was to generate evidence to inform the next phase of programming with a particular focus on what we call nutrition-sensitive components. Next slide, please, Jessica. So we designed a mixed method observational study. So it's not a study designed to estimate causal effect. Rather, the idea was to get a sense of what was being implemented and how was the implementation reaching its intended goals. It included literature reviews of all the different program documents, including all the different partners. We had a round of secondary data analysis leveraging the Somali Integrated Household Budget Survey that provided insights on both coverage and the targeting of cash transfers across the country. We then designed qualitative in-depth interviews with key informants that were implementing the Bahnana program and included a quantitative component, including phone surveys to reach beneficiaries of the program. Next slide. I'm just going to give you a quick overview of what we found. In terms of the first objective was the program delivered as intended. The general evidence suggested that, yes, the program was delivered as per design. The cash transfers were generally targeted to the right individuals. There were a few challenges initially in terms of getting the registry going, but these were addressed as part of the program rollout. There were issues around capacity and coordination and community engagement that were key to ensure the program was successful. These were also, there's also a second or on another side of the coin around community engagement as also a key challenge in terms of ensuring sustainability and effectiveness. The findings were consistent by the type of respondent across the different program activities. What was pretty clear, though, that the integration with the complementary health and nutrition services, which is key for nutrition, but outside the direct influence of the cash transfer implementation, was challenging. Next slide. What did the beneficiaries relate back to us in terms of potential benefits and challenges and opportunities? The beneficiary perception suggested, yes, that the program was sufficient to address basic needs and food security as per design. The perceived benefits were spanned a wide range of intended benefits, pretty comprehensive in terms of its intent and potential benefit streams. However, cash was not enough to meet all the needs, and this was reflected both by beneficiaries and key program stakeholders. And the transfer values now estimated were not even to meet the minimum food consumption requirements, partly because of the sort of high food inflation environment present in the country. What was also challenging was the apparent was the limited use of health and nutrition services, the sort of plus nutrition sensitive activities that are necessary to get that additional nutritional return. It could be that women participants did not have enough financial resources to access them, but it also could be a supply side issue that these services were not readily available or the implementation quality was not sufficient to meet the needs. Next slide. This slide is very complicated. It just highlights the sort of program processes that are required to make the cash and the plus components work. And the important part, I think, here is to realize that the blue boxes that are essentially required for the complementary services on top of the cash that are required to get to meet all the necessary program needs are new components of the new program in its new sort of design. as it's supposed to be reached. So it's a complicated set of activities with a complicated set of stakeholders involved, including complementary services across health and nutrition, but also livelihoods, to make the link between the short-term investment and investments into promotion and human capital investment. For more details on this, I refer interested parties to the very rich study report. Next slide, Jessica, please. So in terms of the key takeaways and recommendations for future programming, there were definitely opportunities to improve the targeting, combining quantitative approaches and categorical targeting, addressing nutritional risk, for example, through integration with softer community-based approaches, and a clear research question in identifying and quantifying potential trade-offs of different targeting approaches. Next slide. There was also important decisions to be made about design features on the cash transfers regarding conditionalities, but also how to readjust the value of the transfer throughout program implementation. And a clear research priority was to assess the effectiveness and trade-offs of alternative approaches, particularly in promoting the health-seeking behaviors that are necessary to ensure that nutrition effects are plausible. And this is particularly a concern in areas where health service provision is a challenge, particularly in rural areas. Next slide. There was clearly an opportunity to introduce particular program variations depending on the context. For example, urban and rural contexts and peri-urban settings, where the opportunities were to include a range of livelihood activities, where in urban areas, the opportunities were more about trying to link with complementary health services that were actually being supplied at adequate quality. And of course, the evidence gaps there were really key in terms of forward-looking research activities. Next slide. One of the key challenges here was to try and address the particular concern and focus on women's empowerment, including specifying both program objectives, but also activities. This is clearly an overarching constraint that was identified by, an opportunity as well, identified by program stakeholders. Next slide. Last slide here. The idea here was to try and include local stakeholders in the program design and implementation to get a better handle of the nuances that the local context variations provided, both in terms of the opportunities for additional design features, but also challenges in terms of program implementation. But it was key to highlight the need for better evidence on key performance indicators that were part of the program impact pathways. They're already pretty complicated, but require careful management in terms of both effectiveness and potential trade-offs. And it was highlighted as a key forward-looking gap, the design and implementation of an impact evaluation of the next phase of programming. I've gone a little bit over time, but thank you very much for the opportunity, and thanks very much for listening.
Great. Thank you, Aulo, for that interesting presentation. I'm going to continue on to present evidence on building pathways out of poverty for ultra-poor IDPs and host communities in Baidoa, evidence from a randomized controlled trial. As Joachim noted, my name is Jessica Light. This is joint work with a large team at IFPRI. So the objective of this project, this evaluation, was to rigorously assess an intervention known as the Ultra-Poor Graduation Program, or UPG, as implemented by World Vision and ACTED in Baidoa, Somalia. And a representative from World Vision will also be joining the panel and can provide more reflections. We worked with these partners to conduct a randomized trial over 3 years to assess the effectiveness of UPG in reducing poverty and enhancing livelihoods within a sample of poor households in Baidoa, predominantly internally displaced people or IDPs, though also including some members of vulnerable host communities. And harking back to Karishma's opening presentation, this is an urban setting, not an encampment setting, and IDPs have not crossed an international border. So these are Somali households that have been displaced from other vulnerable regions in Somalia and moved to Baidoa. The intervention of interest, UPG, is designed to provide extremely poor households with a pathway out of poverty and enable them to build resilient livelihoods. And in this context, in this evaluation, the key elements of UPG, not all elements, but the key elements include the provision of cash transfers to stabilize livelihoods, The amount is approximately $250 over 1 year. Next, households can choose to either receive an asset transfer or participate in technical and vocational training. This allows them to build a foundation for a more sustainable livelihood moving forward. Households also participate in savings groups, and there's coaching, group level coaching provided throughout the program. This follow-up survey was conducted at the conclusion of 3-year UPG program, immediately at the conclusion. So we should note that these are effects right as the program is wrapping up and not long-term follow-ups. Our study design drew from eligible households in 24 IDP sites served by the program, all within the area of Greater Baidoa City. The criteria for eligibility were determined by the implementing partners in conjunction with community stakeholders, and they determined that households that had been resident in the IDP sites for at least 1 year and who reported at least moderate or severe hunger according to the household hunger scale at baseline would be eligible for the program. However, the number of eligible households exceeded the number that could be served based on program funding, and accordingly, a lottery was used to assign households to receive the program. There were 5,000 households included in the program, or to not receive the program. We then surveyed a subset of program households, as well as households that were not served by the program. And you can see here our estimates for the follow-up sample. At N9, we had 2,833 households were randomly assigned to treatment, and 1,136 that had been randomly assigned to control. Given the randomized design, we can be confident these households were similar on baseline characteristics, and that's something we were able to verify in our data, though I won't show those results today. We were able to follow the vast majority, about 96% of our sample, over the full 3-year period from baseline to N9. So let me first present some results. Household self-reported experience of UPG. We can see that the program was implemented with quite high fidelity. So 82% of the treated households had heard of World Vision's UPG program, and 77% confirmed, yes, they had participated. Of course, it's possible that the others had participated as well, but didn't make the link or didn't correctly identify the program as UPG. We see slightly under half of the control households were aware of the program, but very few reported that they had participated, consistent with the design. We also see, again, extremely high fidelity in implementation of the cash transfers. The vast majority of treated households reported receiving the transfers as intended. A small minority of control households reported receipt. That's also possible, but they were misattributing a transfer received from another source. And when we look at the livelihoods components, again, we see a consistent pattern. So in the treatment arm, more than 85% reported, yes, they received assets or TVET training. In the control arm, almost no one reported that they received assets or TVET training. So I will now present some findings that capture the effects of UPG. These are graphs. You can see the 3 time points, baseline, midline, and endline. In years, this corresponds to 2022, 2023, and 2024. Our closing endline data was conducted in September of last year. Here we're capturing per capita consumption expenditure. This was not measured at baseline, but at midline we can see already there's evidence of a positive treatment effect after the treatment households have participated for 1 year. Their average consumption has increased to $2.19 per person, per capita, per day. That's in US purchasing power parity terms. In the control households, it's $2. Again, clearly this is an extremely poor population. The treatment effect has then grown by endline. So control households have slightly increased their consumption to about $2.40. Treated households have increased to $3.20. And that implies, of course, that poverty is lower in the treated households. And you can see that here. So this is the extreme poverty rate using the $2.15 poverty line. You can see by endline, poverty rate in the treated households is 35% compared to 60% among the control households. Number of assets. At baseline, both control and treated households owned about 8.25 assets on average. That's just a simple count. It doesn't take into account the value of the asset. That's predominantly livestock, also some household durable or other productive goods. Treated households show a steady upward trajectory. They own then 10 assets at midline, nearly 12 assets at endline, whereas control households show some stagnation or a slight decline. So at endline, the figure in the graph, 4.76, captures the positive treatment effect that has emerged. We also collected data on more subjective questions. For example, are households able to meet all their basic needs? This is generally reported to be low, perhaps consistent with the high poverty rates, but still there's a large treatment effect. So at endline, only about 5% of control households report they're able to meet all their basic needs, and this has doubled in the treatment group to 10%. And finally, just to briefly summarize some of the evidence around income-generating activities, we asked households a series of questions about whether they're engaged in any income-generating activity and what type. UPG households are considerably more likely to report that they're engaging in an income-generating activity. That positive effect is predominantly in livestock. So among households that received assets, the overwhelming asset choice was goats. About 85% of asset receiving households chose to receive goats, and we can see that effect very clearly here. About 15% of UPG households reporting they're engaging in livestock production, and that's quite small among control households. There's also some shift, but smaller in magnitude, where UPG households are more likely to have formal wage employment or a non-farm business, and they're less likely to engage in casual wage labor. Just to conclude, we see evidence both in the quantitative data and also in our qualitative data. I didn't provide an overview of this, but it was a mixed methods evaluation. We see a range of positive effects, more diversified sources of income, enhanced food security, and a large decrease in poverty rates. So these findings suggest that this type of graduation program may be a promising strategy to enhance livelihoods and build resilience among IDP households, though it's important to continue to assess the longer-term effects of the intervention. Thank you very much, and let me pass it back to Joaquin.
Thanks so much, Jessica and Aulo, for a very insightful presentation. So now it's time to turn to people who are on the policy and implementation side. And I'd like to first introduce and welcome Fardosa Abdullahi. She is with the Ministry of Labor and Social Affairs at the federal government of Somalia, and she manages actually the National Safety Net program, or the BACNANO program, which Aulo was talking about. And she's also the Social Protection Policy Coordinator. So a very relevant viewpoint from the policy side. Fardosa, can I invite you to give remarks for around 10 minutes or so?
Yeah, thank you so much. Thank you for having me. I think this has been very interesting discussion, and the studies both on BACNANO as well as the Beidou research, I think that was very important. Once you see research companies or researchers starting to look at the programs, then you know that at least there is quite good work going on. And really happy to see the recommendations also going forward. So just to speak about perhaps the journey of social protection in Somalia, and I will dive into BACNANO the last 4 years, and perhaps what we aim to achieve in the next 4 years as well. As Aulo has already mentioned, the program started in 2019. However, the journey of social protection in Somalia really started in late 2017, 2018, when we were developing the policy, which was endorsed sometimes mid-July. We have seen already in the last presentations on the different interventions of BACNANO program, which is the National Social Protection Program, and the different interventions, nutrition-linked cash transfer, the systems building, the project management, as well as the registrations. I'm really happy to say that we have now closed the phase 1 of Bahnano, which was did have different interventions. However, we also had different targeting methodology and as well as implementations modality. The nutrition cash transfer has now ended 200,000 households across 21 districts across Somalia, including Somaliland. And we have seen quite a number of successes, but we've also learned quite a lot from the initial design of the project. And going forward, a few things have actually changed, including the targeting methodology that we have used in phase 1, which was community-based targeting. This has actually, after doing an impact evaluation, we have seen that there has been inclusion and exclusion errors. And the policymakers have actually taken a policy decisions to move away from the community-based targeting to more of an objective targeting, which is the proximity testing through the Unified Social Registry. The other achievements that we have actually reached is to ensure that we do, while we have been working, as the previous presenter has mentioned, we have been working with WFP and UNICEF, who have really supported the phase 1 of Bahnano and its successes. Now we have moved to more of direct government implementation. We have registered through the support of WFP. We have registered in the Unified Social Registry about 536,000 households, which is approximately 3.5 million people across 18 districts in Somalia. This has really supported in ensuring that there is a coordination as well as complementarity with the humanitarian responses. So I'm very happy to say that the USR has actually delivered not only the for shock responsive, but also it has delivered on the regular Bahnano program. What we have also included in the USR is to ensure that we capture everyone within the mentioned districts. And we are also hoping to ensure that in the next few years, we will also be able to scale up and register almost 13.5 million people. This includes the IDPs, which is quite a huge number in Somalia, and quite big problems that we have had. And the inclusion of the IDPs as well as refugees in the Unified Social Registry is a policy decision that the government has taken. This really is going to help going forward to ensure that no one is left behind or no one is excluded in terms of reaching out to the most vulnerable. We have also really started the journey of the direct implementation, moving away from the WFP implementing on behalf of the government, but the government implementing itself. This will ensure also there's a social contract. There's also ensure that the capacity of the government is has enhanced. And on the study that Aulo has been mentioning, there has been really challenges in terms of the nutrition linked. And I'm really happy to say that on going forward, we have actually designed a new model where we bring mothers and their children into a one window facility, which they're going to receive all different interventions in the facility. And this will be for the core responsibility cash transfer. One thing we have learned is the nutrition linked cash transfer that we have done has not been able to really reach out to the supply side. So now what we have done going forward in the second phase of Bahnano is having a service delivery mechanism where we bring the beneficiaries into one room. enroll them and give them the supply side of the health, which is the nutrition, growth monitoring, immunizations, all the essentials package of care, and in the same room, make sure that they also received their entitlements. This will ensure that we're starting it as a pilot, but we've also designed the next phase, scaling it up to more districts. This will ensure that we don't just refer them to nutrition centers, but bring the nutrition centers to the one window facility where they get different interventions in the same place. While we are continuing and with the regular cash transfer in the same districts that we have been targeting in the last phase, we will continue doing the same approaches that we have done through a different targeting methodology, as I mentioned. Look at the bottom 10% of the population and reach out to them with unconditional cash transfer. We have also now introduced into our second phase is economic inclusion. As you are aware, Somalia has about almost 60% of its population under the age of 30. So it's quite hard to really leave the youth behind and without any social protection interventions. So we have also introduced economic inclusion, which is going to create jobs, both wage employment as well as self-employment going forward. We have already launched last month the pilot, but we've also designed scaling up of the economic inclusion to over 16,000 youth across Somalia. So what the landscape of social protection looks like in Somalia now is to really layer up different interventions in the same household to ensure there's better resilience, and different household members within the households do get different interventions, and we actually understand that only cash will not be able to build the resilience that we want them to build. And we are also looking at the children who are not going to school, and we have now designed another intervention which is going to look at co-responsibility cash transfer for education. This will also support vulnerable groups that we know in Somalia, 65% of our children do not go to school. We hope that the pilot of these interventions will ensure that the most vulnerable groups of the society are not left behind in terms of education. These interventions will start hopefully by the end of this year. However, the nutrition linked co-responsibility cash transfer has already started. So we're looking at different interventions. However, what we know in Somalia is we also have the biggest issues that is, the recurrent shocks. So we have partnered with different donors to ensure that they use the government system in responding to different shocks. FCDO has actually come on board as of actually early this year, and they have used the government systems to ensure that whenever they are responding to shocks, that the government system will be used. This will actually really support us in terms of coordinating, ensuring that we reach to different people instead of reaching out to the same group, but also ensure that there is some sort of discussions which will bring people together. I'm also really happy to mention that Somalia is now championing or advocating for fragile countries' investment in social protection. We are aware that most of the countries that are fragile normally get humanitarian responses, but they are not supported generally in terms of building systems or investing in social protection. Somalia is co-chairing the high-level panel that has been launched last month in the UK with the British government. And there will be an inquiry on ensuring that fragile countries are actually supported in terms of investing in social protection. I will stop here. I'm not sure if I'm under time or over time, and perhaps to just give opportunities for others to ask questions. Thank you so much for having me again.
Thank you so much, Ferdowsa. That's a really impressive list of efforts currently ongoing from the ministry. Let me already plug a question for you, which I'll ask you to answer later in the Q&A, but I'd love to hear from you what you think the most important research questions are that are pertinent at the moment. If you know, people like Jessica Aulo and the teams that they work with, what, according to you, should they be focusing on? What are the most important questions where, when answered properly, rigorously, decisively, they could really make a difference for Somalia? But we'll come to that in the Q&A, and I'd like to hand over at this moment to Caitlin Whitmore, who is the Design Monitoring and Evaluation Manager at World Vision in the US, based in Maine, I believe. And she supports humanitarian assistance and livelihoods programs across multiple programs, but one of them is Somalia. And she's been deeply involved in the work that Jessica was talking about, and she's also spearheaded World Vision's humanitarian and emergency affairs learning agenda more generally to advance evidence building for humanitarian programs. So floor is yours, Caitlin.
Thank you.
And
Thank
you've
you for
got about
having me.
4 minutes.
Okay, I'll try to speak quickly. So thank you, everyone. I'm going to share about World Vision's work in sort of this integration of research and learning with implementation, and what we've been doing with the ultra-poor graduation model in displacement contexts. World Vision has been implementing the UPG model for a long time. We consider it one of our core program models. A lot of organizations have been using it, and we know that it's a very well evidence-based model, and that it's effective in graduating people out of poverty. But there's actually not a lot of evidence. It's growing, but at the moment it's still pretty scant around the effectiveness of the UPG model in displacement contexts. So World Vision has been on a sort of evidence building journey over the past 4 years, where we've been testing the model in various displacement contexts, including in Somalia. And we have been trying to understand not only is it effective, but also what are the unique challenges that displacement contexts present, and what are some potential adaptations we need to make to this model in order to make it feasible and effective in displacement context. So I'm just going to briefly mention some of the challenges that we've identified through operational research and learning events, and also more formal research like the presentation that Jessica gave. And then I'll mention very briefly, probably just one example of how we've incorporated an adaptation into sort of a follow-on program that we're testing. So some of the unique challenges that we've identified, and some of these have actually already been mentioned by others on the call already. So one is that we find that among displaced groups, there are generally higher levels of vulnerability and also more uniform levels of vulnerability. So some of the traditional methods for targeting that have been used in UPG programs aren't maybe not optimal for displacement contexts. We also see that we have extra challenges in accessing displaced populations. Often there are multiple groups that need to be coordinated with, including groups like UNHCR, WFP, governments, and it just creates extra levels of coordination. Sometimes there's also barriers to access on the side of the displaced groups. So they might have limited mobility outside of their camp or settlement settings. They also sometimes have limited ability to access markets or resources. And sometimes there's even legal restrictions on their ability to move or to work. We also see that there are greater social fractures in these groups. So these displaced populations are obviously away from their home communities, and so they don't have those networks. And also there's sometimes tensions between the displaced groups and their host communities. And then the last one that I'll mention, which isn't the complete list, but the last one I'll mention for today, is that we often find that these groups have been in these displacement settings for long periods of time. Sometimes their stay in these camps or settlements are even generational. And when they have been in these settings for such a long period of time, there's often entrenched dependency mindsets where they've had to rely on humanitarian aid for very long periods. So at World Vision, we have looked at all these challenges and we've tried to identify adaptations to the UPG model that we can test so that the model can be more effective in displaced settings. And one that I'll mention now is related to this last point about around dependency mindsets. We find that especially in a model like UPG that has these large infusions of cash transfers and asset transfers, it's important that the groups are sort of ready to be self-reliant, to graduate from humanitarian aid. And so we have introduced a mindset change intervention. It's one of World Vision's core project models that we apply in other programs as well. It's called Empowered Worldview. And we have integrated this into UPG as part of especially the coaching pillar. And we are testing it and trying to see whether this makes a difference in the ability for refugees and IDPs to become self-reliant at the end of the UPG program. So I have others that I can share if there are questions, but I will stop there for time. Thank you.
Thanks so much, Caitlin. That's great. I'll hand over to Segun Tekun. He is a social protection expert working at the FAO, normally based in Somalia, I think, but today he's joining us from home in Abuja, Nigeria. Segun, welcome. And like Caitlin, you'll have 4 minutes, please.
Yeah, thank you so much. Thank you, Joachim, and good to see everyone, and including Fadosha. So just to also say that for FAO Somalia, we have started the mindset shift that is needed even within our own internal programming of integrating resilience into our social protection programs and also the humanitarian services that FAO Somalia offers. And I would say that in 2019, as a result of this, we implemented transitional cash transfer and livelihood programs. And the evidences from those programs that was implemented by FAO Somalia actually also agree with the evidences that have been shared here today. But one thing I would just like to highlight, I mean, going from the global impact evaluation work that FAO is doing, you might have heard about it, from protection to production. This impact evaluation has really shed some few light about integrated programming. One of those issues that the impact evaluation has raised is the importance of sequencing and layering. Most of the time, we've seen that integrated approach actually have all of the elements in the design, but the timing of when it should be implemented, for example, when should cash be implemented for and for how long, and when do we bring the livelihood element and this other element that has been mentioned here, it's very important, and it also have a very key factor to play in what the result of the program would say. For us, the question is, now that we know that economic inclusion, livelihood, integration into social protection programs, whether it's for IDPs or for rural population, is important. And the question is, how do we ensure that it is sustainable and it's integrated within the government social protection programs and its policies? So we are supporting the federal government of Somalia through the Ministry of Labor and Social Affairs to develop a technical guideline for integrating livelihood into social protection programs. And it's expected that this technical guideline would guide future interventions that the country will be implementing on integrating livelihood support into social protection programs in future. The other thing that we're also supporting the government to do is that we are trying to bring effort of relevant partners. You may agree with me that livelihood cut across, especially for the work that FAO does, cut across ministries beyond the Ministry of Labor and Social Affairs. So we are trying to bring the necessary institutions together to be able to discuss and see what is good for these vulnerable populations, what are the livelihood zones that we have, and what are the packages that will be provided to them. So we are supporting the government to have a productive safety net program task force, but of course there is the livelihood integration task force within this task force. So I think this is what I would like to share about sustainability and going forward. But most importantly is also the finances. We understand what is happening within the finance landscape now. So we are also supporting on how to start looking at domestic resources. What are the innovative financing mechanisms that can be used to fund social protection, and importantly, integrated approach like this. So this is one of the areas of work we're leveraging on diaspora co-financing. We're leveraging on looking at different, for example, seeing tax model. How can we use taxes on sugar and beverages to fund social protection, and just looking at these innovative financing models to ensure that it is sustainable beyond the World Bank funding that we currently have for social protection programs in Somalia. And I think this is all from my end, but thank you so much for having me.
Thanks so much, Segun. It's great to hear from FAO, a really important player there in this landscape. I'd like to turn over to Alessandro Bini. He's the director at the Somali Cash Consortium, which works under Concern worldwide. And he has been working in the humanitarian sector for 20 years already in 12 different African countries, mostly on cash and voucher responses and designing cash-based social transfers with humanitarian responses. So Alessandro, over to you. You've got 4 minutes.
Thank you very much, and thanks for giving the opportunity. It's good to see a lot of colleagues that we work together daily on Somalia. Look, from my part, I just wanted to share some key lessons learned from the implementation of the SAGAL Social Transfer Program, which I think can be useful for this discussion. So Somali Cash Consortium has been implementing the SAGAL Social Transfer Program since 2020. So SAGAL 1 is now completed, and we just started SAGAL 2. This is with the support from European Union delegation, Swedish Embassy, Danish Embassy, and ECHO, DG ECHO for the response side of it. Yeah. And the program has been implemented with the Ministry of Labor and Social Affairs. So I focus on 4 lessons learned. So the first one is the targeting. So SAGAL has used categorical targeting from the beginning. So using life cycle approach and focusing on specific vulnerable categories. Yeah. In phase 1, we work with pregnant lactating women, unemployed youth, people living with disability, and elderly. The key lessons that we are taking into SAGAL 2 is the use of categorical targeting was really well accepted at community level because it was easy to explain and easy to receive from community. Community themselves were able to self-monitor it to make sure that there were no sort of exclusion or inclusion mistakes in it. These work particularly well with the pregnant lactating women. One of the key lessons of this is obviously that we are reiterating in SAGAL2 because it did work very well. But also that in order to make it work even better, we need to revise the geographical footprint to make sure that in the districts that are targeted, we can do a sort of a universal coverage of the category, because that was one of the areas of improvement. A second lesson learned would be around, I think, a topic that Cardoso has been talking about as well and implementing under BACNANO, is related to linking different services to social protection. For SAGAL in particular, this has been health and nutrition services. The way the linkage has been done start from the referral. So the referral into the SAGAL program come from the health centers. So the health center and the health center staff are those doing the initial referral, and then there is the registration into the social transfer program. And then linked to the regular cash transfer, we have a behavior change communication strategy, a series of messages via SMS and via voice recorded messages that sort of reiterate the link and the necessity to visit the health center regularly. Now, what we've seen in the final evolution of SAGAL1 is that these greatly improve health-seeking behavior. So a lot more women went for antenatal care, for delivery at the clinic, and for postnatal care, including vaccination and nutrition growth monitoring. Obviously, the same can be done for other services as well. They could be linked to it, but we have this first evidence already. The third point is related to government capacity building. SAGAL is implemented with the Ministry of Labour and Social Affairs. The focus initially has been at federal level in terms of the technical support, but then halfway through SAGAL, we saw that there would be a lot more to gain, or at least a lot of value added as well in bringing the support at state level, given the federal structure of the Somali government, and at district level. So SAGAL2 actually focuses a lot on district level because that's where you can have direct operational involvement of the ministry staff. And then the fourth point is around Nexus programming. So during SAGAL1, we use a sort of a more standard shock response approach with the early warning system and the capacity to expand horizontally and vertically in case of shocks. In SAGAL2, we are testing a different design, which actually links the humanitarian response with the social protection response. So we have a larger, longer, more flexible window of registration and a focus on newly displaced households. So that these newly displaced households were being registered and have received initial support from humanitarian agency can be referred into the program and start receiving longer term support. And linked to this, there is a more focus on the actual geographical selection of the areas where we work that tend to take on board more humanitarian parameters. So we go more for area in high humanitarian needs. Yeah, I think I'll stop there, and thank you.
Great, thank you. Thank you so much for those insights, Alessandro. I'd like to hand it over to Laksiri Nanayakara, also based in Mogadishu. Laksiri heads the WFP's vulnerability analysis and mapping for Somalia. And actually over the past weeks, we've been interacting quite a bit with Laksiri on research, on doing some research around questions about the length of for how long the support is given to their recipients and what kind of impact that might have. So Laksiri, just like the others, you have 4 minutes.
Thanks a lot, Yakim. I assume that everybody can hear me. Actually, all the presenters reiterate the significance and the timing for us to move on the longer-term sustainable investments for poverty alleviation and self-reliance programming, rather thinking of short-term life-saving interventions, which can be rounds of life-saving assistance in Somalia. But my points are more or less around what could be the challenges that we are meeting, how we should be mitigating, and also our presence in Somalia, how the strong partnerships that we have with the Ministry of Labor currently moving these efforts led by government towards the social protection programs, and how we can achieve self-reliance for the populations under the risks. The first one, I wanted to a little bit allude you about the trends of food insecurity and poverty in Somalia. As the co-lead for the IPC Technical Working Group, we have been noticing that if you are going back to the last decade, the food insecurity trends, the population above the crisis of food insecurity levels are at the peak in many of these years, including every 5th year it will reach a peak. So average 4 million, and it reached the 6 million during the 2022 risk of famine, and also in 2011, likewise. So has it been diminishing or has it been increasing? So Marvelous, the presenters also explained about the increasing risk of repeated natural shocks, or else the protracted crisis and displacement has triggered or has driven food insecurity and poverty. But that is why, most importantly, we need to also focus on the social protection and resilience action, because then we know that it's importantly we can assure some of the population can be resilient enough to cope up with the repeated shocks. So that's why I think our emphasis and our interconnections between the assistance programs should be emphasized. The other one, most of the presenters also again explained about the importance of investment in emergency preparedness and anticipatory shock response, particularly the classic and examples presented by Vardoza about the shock response is really an instrument to reduce the risk as well as the exposure of the disaster-affected populations, particularly during the floods and droughts in Somalia. And it made significant effects as per our evaluation studies. As you all know, we can save almost $13 if you see the return on investment of the preparedness action on $1 investments. Means that we should be having a major focus on shock response instead of the kind of the temporary assistance in form of rapid response. The last point is more or less about one size does not fit all, because we also know that still the things are not that simple in Somalia. Contextually, the poverty statistics clearly outlines this: 54% are below the poverty line and 20% are at least below the abject poverty line. Means that the food insecurity is existing everywhere as chronic levels. So more or less we need to see what are the opportunities, where are the geographical spaces that we can start interventions linked with social protection immediately. They can be self-reliant, and also we can also see the program integration. What could be the most important step for us to see integrated programming between different programs, which links gradually the sustainable livelihoods of the population. And my last point is about the research and evidence generation. Thankfully to all the research presenters here, there is a lot of important information at the table for us to ensure that we have proper planning for social protection systems in Somalia, where the people can benefit from longer term programs planned here. In addition to these evidence pieces presented, WFP will also continue to generate more research pieces, including we now just concluded a study about the food security situation in Somalia with the food security FAO and as well as government National Bureau of Statistics, which will understand the root causes as well as structural impacts and all the root causes related to food insecurity and acute and chronic malnutrition in Somalia, which will guide us to design and see what are the root causes, how it could be the self-reliance could be achieved, supporting through the livelihood pathways. The other one is actually, again, if you touched about the innovative financing techniques or systems, that is also another area that we are thinking of, because WFP is investing to see what could be the innovative financing strategies to ensure sustainable resources for the populations to assist with the proposed programs, given that you have seen that the resource base is reducing significantly, and also globally the emergencies are growing every day. So that we need to also think about the innovative financing systems. So those are the areas that we will continue to lobby in. In addition to that, what Joaquin mentioned also, like what should be the linkage in terms of the proper duration of humanitarian intervention for emergency response, and how it could be linked with the sustainable social protection programs with the self-reliance objective. With that, those points, I would like to hand over back to Joaquin and the team. And if you have any questions, please feel free to post in the chat. Thanks a lot.
Thank you. Thanks so much, Laksiri. And I noticed you mentioned the different costs between preventing or averting hunger or humanitarian assistance. And I see our colleague Olivier Ecker has joined, and he's done quite some work on that. So Olivier, maybe later you'd like to jump in and briefly describe that. But let me, before that, let me give the floor to Karishma. Karishma, I see you've given quite an elaborate response in the chat. I'm not sure if you want to just quickly qualify that with a quick verbal response. I haven't been able to read it yet. And then we'll go to Fardosa, and then Olivier, if you want to jump in, feel free. I don't want to put you on the spot either.
Okay, great. I'll try to keep it quick. So on the funding model that we had talked about in my presentation, someone had asked about what this might look like. And the paper elaborates further, but essentially that financing for forced displacement situations is directed through governments rather than through humanitarian agencies, that it's additional to the financing cap of developmental financing that goes to host countries, because there's an opportunity cost of expenditures on post-displacement solutions. We see that a bulk of the costs are recurrent. For instance, including refugees, international education systems, the bulk of the cost is teacher salaries. So those are recurrent, but development financing tends to focus on investment spending. And so we need to be able to finance recurrent expenditure for government. And then finally, shifting towards a more rule-based allocation system to address some of the large variations we see across countries in the amount of financing available. And I've put a couple of points on what the criteria could be, but this is similar to what is done for IDA allocations. Oh, and I should also add on the additionality of developmental financing. So the World Bank has a window called the Window for Host Communities and Refugees that does exactly that. Thanks.
All right. Thank you. Thank you very much. Fardosa, do you want to jump in at this point about research priorities?
No, thank you so much. And good to see my colleagues from Somalia also presenting the current work. So just on the research, I think what I haven't mentioned is that unfortunately on our first phase of Bahnano, we have not looked at impact evaluation, and because when we started, we did not have the baseline. But I'm very happy to say that now we are planning to do a baseline and have rigorous impact evaluations in one of the districts. So that will be for the unconditional cash transfer, and it will be a full research and RCT to ensure that we do get the real impacts that the cash transfer is actually giving. And you have asked about what sort of questions should be, asked. I think there is, to be honest with you, and obviously with the shortages of funding, we do really want to see, researchers coming in to see where the gaps are. But I think one of the major things that I would like to see the research on is on the uptake of services and on the CCT health. Is it going to be increasing? Because the service delivery model that we are now doing is going to be inside a hospital. So we are actually bringing the beneficiaries inside the hospital and ensuring that all the health interventions that they would require would be available within the time of enrollment, and they can do that. So maybe in that area, it will be good to see if the uptake of services can be increased, especially bringing the beneficiaries to where the services is. There is obviously, a lot of research that could be done, behavioral changes, because there will be behavioral changes, communications within those sectors. The other part that maybe we haven't done, but we did have some anecdote evidence, is to see the reduction of people leaving their rural areas to come to urban areas to look for funds. So what we have seen anecdote evidence is that less people have actually moved to urban sectors as IDPs, and this is for the Bahnano beneficiaries districts. We have also seen that during shocks, schools were not closed, but then we don't have real research to really inform us on that evidence. I just want to touch a little bit on the financing, which is really the $1 million question. And as you're aware, Bahnano is now fully financed by the World Bank, and fortunately, it is a grant at the moment. But the question that we asked ourselves is, when we start moving to loan, how will the government, take the trade-offs? Will they be investing in infrastructure, or will they be investing in social protection? So I think new models of new funding models, as one of the speakers mentioned, I think is really important. And what we starting to look at is, where else can social protection be financed from? We're looking at the zakat, because Somalia is an Islamic majority Muslim countries, and we know that 2.5% of the wealth is actually given out annually. So we are looking at the national resources once we start having the national resources, what sort of allocations will be for the vulnerable community. So I'll stop there.
Okay, very good. And I did just want to quickly check that we don't have Alejandro de la Fuente dialing in from all the way from Mexico City. I understand it's very early there. We did offer him slots, but it doesn't seem like he's here. I didn't think so, but I just wanted to be sure. Okay, so we're actually out of time, but Olivier, if you want a minute to explain your work, you're very welcome to do that, and then we'll wrap up right after. Otherwise, we will.
Hi Joachim, thanks a lot for having me, and thanks a lot for inviting me. Yes, I just wanted to mention very briefly one study that we are currently working on, which is called, or which deals with the aspect of humanitarian food assistance awarded, and that specifically is what we do in Ethiopia, but we also plan to expand it to other countries. What we do here is we compare investments into resilience building, especially in the agriculture sector, versus humanitarian food assistance, and to try to estimate different cost-benefit ratios under different drought scenarios. So the question, of course, is, what is better to invest into humanitarian assistance, having humanitarian assistance programs, or agricultural resilience building programs? And it's not only a question of either or. I think the key question is, what is the optimal combination, especially for the population that is affected? I should say this is a modeling study, but which is informed by actual data from World Food Program and for the humanitarian food assistance side, and different agriculture programs on the other side. Thanks. Over to you.
All right, thank you very much. And I think with that, we should really wrap up. So I really want to thank our speakers. Thank you so much for making time for this, for the wonderful interactions and your responses. Thank you very much, the audience as well, for joining this webinar. And we hope that this is going to be able to advance the conversation on these really important topics. So with that, all the way from Malawi here, I wish everybody a good morning and good afternoon or a good evening.